Hi, my name is Isaac Berg, and today we are going to look at signs and symptoms of drug and alcohol use. This is a requirement on the DOT regulations to have specific training on recognizing the signs and symptoms of drug and alcohol use in the workplace, particularly for supervisors. So we're going to go ahead and look through the different drugs and indicators and alcohol indicators that will pretty much tell us when we have reasonable suspicion or reasonable cause to drug test or alcohol test an employee. So first, we're gonna look at the particular drugs that we're testing for DOT tests. We have a 5-panel test, and it includes marijuana, cocaine, PCP, and then we have the opiates or opioids, which is going to include heroin, as well as morphine and codeine. And then we have the amphetamines, which also includes methamphetamine and MDMA and MDA. And then, of course, we also have a separate drug test, which is for alcohol. So there are very similar warning signs of substance abuse for pretty much every single drug. So we're going to go ahead and look at that. So absenteeism. So that is when an employee is missing a lot of work, calls in a lot, leaves work early, comes in late a lot. It's going to be one of the indicators of drug use or alcohol use, and you're going to see it in most people who are misusing or abusing drugs or alcohol. And then, of course, we have frequent accidents. So this can include accidents on the job or accidents at home or non-work accidents. One of the things that you see as well, if you have a group insurance, as an employer, you'll also notice that they have a lot of insurance claims, or recent insurance claims, I should say. Right. So poor motor skills, it pretty much means day-to-day tasks they have a hard time doing. They have a hard time being able to concentrate, which leads to that poor motor skills. But also, you'll notice the balance is off a lot. May have some lack of coordination there. All right, so risk taking, particularly unnecessary risk taking, where they take risks that could be harmful to their health or someone else's. That's really unnecessary. And of course, if your employee's taking a lot of trips to the restroom or a lot of trips to the parking lot or their automobile, that is also a warning sign that they may be abusing alcohol or drugs. All right, so now we're going to look particularly at marijuana. So these are the ones that I guess you would say the most easiest indicators to see from the outside, and that is the reddened eyes, or I guess you could say bloodshot eyes. Also, you'll notice that they'll speak slower, particularly if they're high at the moment or they're currently using. They'll have slower speech. And then marijuana has a distinctive odor. Particularly, it smells like burnt rope. Well, that's how most people would describe how it smells. So you can pretty much smell it on their clothes if they've recently used. A lot of them try to hide it by spraying cologne or whatever, or breath mints. That actually could be, if you always see somebody with breath mints in there, you see they have all those other indicators there. That can actually be another indicator that they actually are using. You'll see no motivation from this employee. They never want to get the job done, or they take forever to get the job done because they're not motivated to do the work. And then uh, this person will have normally have a sore throat or cough if they're using a lot. Next, we have indicators of cocaine use. So here are some of the symptoms that a cocaine user will have: a runny nose. Uh, so you'll notice that they always have to wipe their nose. They're always wiping it constantly, and it seems to never be going away. And then, of course, dilated pupils. And so if you have a couple of these together, you can see how you can have reasonable suspicion to have them test. If they have impaired vision. And so we're talking about somebody who normally doesn't, they don't wear glasses, they don't have a prescription, but they're having problems seeing. And then they appear paranoid. So this is for normally, heavier users or consistent users. They'll always be paranoid. They think you're out to get them, or somebody's always out to get them. And then they have profuse sweating. And then another attribute is they talk way too much. They don't know when to stop talking, and they're constantly running their mouth. All right, so next we have PCP. So you'll see some of those same attributes for PCP as the previous drug, and a lot of these have some of the same attributes. So we have dilated pupils, and then erratic eye movement. So erratic eye movement is they move in their eyes are just never stopping, moving back and forth all over the place. Abnormal eye movement. And then we have profuse sweating, and then poor balance. So you may see them trip a lot, or fall, or have to catch themselves. Another distinctive attribute: easily agitated. So they get upset pretty easily. You may say something to them, and if they don't like what you said, you'll know it. And then they seem to be confused. So you give them instructions, they don't know what to do. They seem confused about the instructions, even though, you should know if you've given them instructions before and they understood, or most people do understand your instructions. But this person seems to be confused most of the time. And they have some of those same other attributes. And one of the things that make using this drug on the work site very dangerous is they have a Superman complex, which means they think they're invulnerable. They think they can't be harmed. So they tend to take risks, very unnecessary risks, that can possibly harm themselves or even other people. And then we have indicators of opioid use. And so we have slurred speech. So they talking, and their speech is slurred, but it's not a normal. You can tell because if it's not a normal slurred speech that they normally have, so that's pretty big indicator that they're using. Dilated pupils, poor balance, so prone to falling or missteps. Having to catch themselves. Mood changes. So one moment they're happy, the next moment they're upset. Or they're angry. Okay, so mood swings that obviously are not normal. And they have no coordination, no hand-eye coordination. So it's hard for them to get the job done. If it requires some coordination, they have a hard time with it. And then this person will always appear as if they are tired. So every day they come in and you ask, oh, you didn't get no sleep last night? Oh, I slept all night. But they're still tired every day. So these are indicators of opioid use. And now we have amphetamine use. All right, so for amphetamine use, some indicators or symptoms of amphetamine use or profuse sweating. We have dilated pupils, and then they always seem to be confused, not sure what they should be doing, confused about exactly what they should be doing on the work site. Uh, they tend to talk way too much, and then they have a increased increased heart rate. They tend to be breathing very fast, uh, and they tend to be in a panic mode, like always alert, uh, always over dramatized, and overreacting to situations. Okay. And then finally, we have indicators of alcohol use. So, slurred speech, one of the number one indicators. They can't speak clearly, or their speech is slurred. They have bloodshot eyes, and then of course, for alcohol, that's one of the easier ones to tell because alcohol has a very strong, distinctive smell that majority of the population knows when they smell it. So you'll be able to smell the alcohol in the person. And then, of course, very poor balance, a lot of falling, stumbling, uh, and it's very difficult to concentrate. Uh, and of course, alcohol users also have mood swings. So one minute they'll be happy and laughing a lot, and the next minute they'll be upset and angry and cursing you out. And of course, for heavier users, they have tremors. Where they get the shakes, and you can see, they have the shakes, and this could be uh, from withdrawals, not they need another drink, and they want more. So these are all the indicators of substance abuse, and if you run into a few of one of these indicators, it gives for reasonable cause, a reasonable suspicion in order to do a DOT drug test or request a DOT drug test.